Ever feel a tight pull in your heel, a twinge in your calf, or that terrifying snap in the back of your ankle mid-run? The strongest tendon in your body, yes, your Achilles, is also one of the most vulnerable. And when it starts talking, it is not whispering. It's trying to save you from a full-on rupture. So let's decode what your Achilles is actually trying to tell you before it's too late. Hi, I'm Dr. K. Over the last decade, I've had the honor and privilege of working with thousands of women on their health journeys. One thing that most of them have in common though, they have been told that their pain is all in their head. Today, that changes. Today, we focus on becoming our own best advocates and learning how to support our body in its challenges, not ignore them. Welcome to Decoded. Let me introduce you to the most epic overachiever in your entire body, the Achilles tendon, named after the Greek hero who was invincible except for the spot where this very tendon lives. It's the largest, strongest tendon you have, connecting your calf muscles, the gastrocnemius and the soleus, to your heel bone. And yet, it's the site of up to 12 times your body weight and force when you run. So think about that. If you weigh 150 pounds, your Achilles might be handling something like 1,800 pounds of load with each stride. Crazy, right? Here's the real kicker. The Achilles doesn't just snap out of nowhere. Most injuries happen when you're transitioning from an eccentric deceleration to explosive movement. Okay, in English, that's when you're slowing down and then suddenly pushing off, like mid-stance during walking or running, that moment when you push off to sprint, jumping and landing. Strains actually happen whenever the tendon stretches 4% of its length, and ruptures, that's when it stretches past 8%. Ouch. But that can be one mistimed step, one hill sprint, or one cold morning jog away. Now, not all Achilles issues are dramatic. There's a slow, sneaky version called Achilles tendinopathy, and it's more common than you think. This is not one big injury, it's death by 1,000 micro tears. It's repeated overload and poor healing. That equals collagen fibers getting disorganized, stiffed, and inflamed. And guess what? You can have it happening with zero pain until suddenly you do. One study found that 25% of runners had tendon damage without any symptoms, and they were much more likely to develop pain within that same year. So who's at risk? Honestly, more people than you think, but especially if you check any of these following boxes. For instance, if you're between ages 30 and 50 years old, you've recently taken up running or picked it back up after a break that you had, you wear high heels often, you do any type of speed training, sprinting type of drill, you have tight calves or poor ankle mobility, if you've had a previous Achilles injury before, or even your foot type plays a role. Flat feet or high arches or limited ankle dorsiflexion can all increase strain. And fun fact, actually, Achilles injuries happen more on the left side, and they happen more in the peak of spring months. Maybe we came out of hibernation just a little bit too hard. There are two major kinds of Achilles tendon problems, and knowing which one you have happens to make a huge difference. So let's talk about them. One is insertional tendinopathy. That's where the pain is where the tendon connects the heel to the bone. That can also lead to a bony buildup, like a pump bump or Haglund's deformity. That is often aggravated by shoes rubbing or walking uphill. Non-insertional tendinopathy is pain about 2 to 6 centimeters above the heel. This is the most common site for tears. It is also what's called a watershed zone. So there's poor blood flow, lots of mechanical stress, and this is where most runners and weekend warriors get into trouble. Achilles injuries unfortunately don't just go away. You can rest it, ice it, tape it, but unless you treat the why, it'll come back the minute you start moving again. At our clinic, we love to look at the full picture. We want to see how your ankle moves, what your gait says, whether your glutes are firing or not, how your foot strikes, your calf strength, your core stability. Because if you're not transitioning smoothly from shock absorber to propulsion, the Achilles takes the brunt every single time. In my clinic, some common treatment strategies are things like eccentric heel drops, soleus and calf strengthening, soft tissue work, ankle dorsiflexion mobility, postural adjustment, turn to run protocols, breath work, and pelvic control. Your Achilles isn't just a tendon, it's a messenger. When it starts to ache, feel tight, or twinge, don't just silence it with ice and hope. That stiffness in the morning, that tug during your jog, that hesitation to put off, that is your body asking for attention, for balance, and for proper mechanics. You don't need to push through. You need a reset and a strategy, because pain is a signal, it is not a sentence. Now, you happen to know more about your Achilles tendon than most people ever will. But information without action, that's where people tend to stay stuck. So take what you learned today and start listening a little differently. Next time on Decoded, the ABCs of what your body's actually trying to tell you, we're tackling A again for acute cervical torticollis, aka that type of pain in your neck where you wake up and it just ruins your entire day. I'll see you there.